Namaste. Myself Dr. Zenica Dsouza, Professor and Head of the Department of Kayachikitsa, Yenepoya Ayurveda Medical College and Hospital, Naringana. Here before you to present with my presentation on Pathya Ahara. The specific learning objective of this presentation is to explain about the application of Pathya Ahara in health as well as diseases. The contents of my presentation would be an introduction in brief, what is Pathya according to Ayurveda, Pathya Ahara in health conditions, Pathya Ahara in diseases, the summary and references. This term Pathya is a very familiar term to most of us, whether it is a layman or a person in the system of medicine. Today we understand the meaning of this term Pathya in the view of Ayurveda. We have this very famous quotation, Patye sati gadartasya kim aushadam nishevane, Patya sati gadartasya kim aushada nishevane. Though both these terms, lines look alike, there is a lot of meaning within and the differences between the two. The first line tells that Patya sati gadartasya kim aushada nishevane. If a person follows Pathya krama in Ahara and Vihara, what is the need of aushada? That means to say, a person who follows Pathya Ahara Vihara krama will not have the fear of getting any diseases at all. The other way around, Patya asate gadartasya kim aushada nishevane means even if a person consumes aushadas and does not follow the Pathya, then in such a person the disease would not respond very well though he is consuming the medicines. That means to say this Pathya is very much important for maintaining health as well as the control of diseases. When we understand this term Pathya, it is in a broader perspective applicable both for Ahara as well as Vihara kramas. That means food as well as lifestyle regimens. In a broader context, we apply this as Pathya Apathya, where we also talk about that what is Apathya in terms of Ahara and Vihara. But I restrict this topic for Pathya Ahara in today's presentation. What is Pathya according to Ayurveda? Acharya Charaka explains as Pathyam pato anapetam yatcha uktam manasaha priyam yatcha apriyam apatyam. So here the meaning of Pathya is that which is very conducive to the Pata. The Pata means srotas. The human body is made up of innumerable srotas, macroscopic as well as microscopic, from the system level to the cellular level. And Pathya is that entity which is wholesome, conducive to all these srotasas within the body. Yatcha uktam manasaha priyam. At the same time, this Pathya as an entity also has a very pleasurable effect on the mind. That means to say, Pathya is an entity which is very wholesome to the Sharira. At the same time, it is also very wholesome, acceptable and pleasing to the mind as well, wherein this root derivation of the term Pathya comes from Pati, which means srotas, that which is hita or wholesome or conducive to the srotas is Pathya. First we talk about Pathya in the case of health, and then we come to Pathya in conditions of diseases. Here I restrict to Pathya in the form of Ahara, Ahara Pathya in Swastha. Charaka Sutra 25th chapter gives us a list of different categories of aharas and also tells what is hita, what is shreshta, what is tama in Pathya among the different list. Say for example, in the case of Shukadanyas, that means the monocots, Charakacharya tells that Lohita Shali, that is red rice or Rakta Shali, is Pathya Tama. That means among the Pathyas it is Shreshta, Shreshta Tama. It is Lohita Shali is Shreshta among all the Pathyas. Likewise, when we come to the Shamidanyas, Acharya tells that Mudga is Shreshta among the different Shamidanyas. The dicotyledons, Mudga is Shreshta. In the context of speaking about the different types of Jala, water, sources of water, he tells Antariksha Jala, that means rain water, that is said to be Pathya or superior among all the other waters. In the Lavana Varga, Saindava Lavana is Shreshta and this is very much Pathya to the body. Likewise, he goes on explaining which among the list of the food entities in different categories is Shreshta. He tells among the Vasa, it is Kukkuta Vasa, that is Shreshta. Among the Stavara yonis of the Thailas, it is Tila Taila, that is Shreshta. In the Kshira Varga, the milk category, Gokshira, that is cow's milk, is Shreshta. And Gruta or Sarpi, it is Gogruta, that is Shreshta. Among the Kanda, the tuberous food substances, Shrungavera is said to be Shreshta, likewise so on and so forth. These entities are said to be Hita to the Sharira by its nature, by virtue of that food entity, they are Hita to the body and therefore they are ever conducive to an individual at all times and in health also. Now this is a list of entities that are considered to be Shreshta Bhojya Dravyas in Rajanigantu. Among the Dhanya Visheshas, Shreshta is Shashtika Shali and this Shashtika Shali is that elevated with its virtues and qualities that a noble person can have it at all times. Likewise, in the case of Mamsa Varga, Aja Mamsa is said to be the Shreshta. Titira and Lavaka Mamsas are the Shreshta Mamsas which are considered in the flying birds, that is birds or flying animals. Among the Paniyas, that is the drinkables or the liquids, water is Shreshta and the water which is collected from Krishna Mritsna, that is the water reservoir which has black mud is said to be Shreshta. Among the Kshira Vargas and the derivatives of the Kshira like Gruta, Navanitadi, Aja and Gokshira is said to be Prashasta. Now these are just two photographs because repeatedly in the Shastras, in the Mamsa Vargas that come from the flying animals, that is birds, the reference goes with Titira Mamsa, which is the Francolin partridge, and the Lava Mamsa, which is the common quail. These two are considered as Shreshta in the Mamsa Varga of the birds. We have this list of Hitakara Ahara Dravya Samuha, again the reference from the Raja Nigantu, where a person is advisable to consume these type of foods throughout his life at all times like Gruta, Saindava Lavana, Dhanyaka, Jeeraka, Ardraka, Tanduliyaka, which is a variety of amaranthus, Patola, Alabu. These are all the varieties or the examples of the green and vegetables, greens and vegetables of leafy variety that could be used. Goduma, Jeeranashali, Mudga are the ones among the monocots and the dicots that are advised to be consumed on a regular basis. Gokshira and Udaka in the water, Hamsodaka, the water which is collected from the reservoirs after the monsoons, where it is exposed to the sunlight of post monsoon and the moonlight in the night, and this water is said to be Shrestha. Coming to the Pathya in the context of Sadapatyam, among all the varieties of the food substance, Charaka in Sutrasthana enlists a set of items which could be consumed and must be consumed, that is Abhyasat, should be habituated and can be consumed on a regular basis. Those entities are Shashtikashali, Mudgamscha, Saindava, Amalake, Yavan, Antariksha Payaha, Sarpir, Jangalam, Madhu, Cha Abhyaset. Shashtikashali, Mudga, Saindava, Amalaka, Yava, Antariksha Jala or Antariksha Paya, rainwater, Sarpi of the Jangala Prani and Jangala Mamsarasa and Madhu. These are the entities that should be habituated by an individual at all times because they are always Pathya for an individual. Now we move on to the Pathya in case of diseases. Just like the maintenance of the health of an healthy individual is by following of the Pathya Kramas related to Ahara Viharas, there is also a Pathya Krama that Acharyas have mentioned according to the disease conditions. We pick up a few examples here and talk on that in the respective diseases as examples for Pathya in diseases. Some of the common disease conditions that are considered and the Pathyas that are advised with the text references, where these Pathyas also play a role as that of therapeutic diets. That means they are entities of the diet, but they also have a treatment role, the therapeutic role. These are the therapeutic diets which are used in diseases. In the case of Amavata, when we go through the Chikitsa Sutra of Amavata, we have the reference of this combination of 5 plant origin drugs, that is Panchakola. And Panchakola in its different forms should be consumed by the person who is suffering from Amavata. It could be in the form of Pana, that means the drinkable entities could be in the way of Panaka, or the water that is consumed by the individual being processed by the Panchakola, or Panchakola Fanta is ideal, and the same Panchakolas can also be added to the food entities or the Ahara of the individual and given to the person who is suffering from Amavata. So, processed food, processed drinks by Panchakola in Amavata is mentioned. Likewise, we also have in the context of Jwara, especially when it comes to the Taruna Jwara context, where the Ama has to undergo a phase of Pachana to convert that Jwara from the Sama to the Nirama condition. There are references of different Pachana Upayas, out of which most of these entities are the food as well as the liquids that are consumed on a regular basis. One of them is Ushna Jala, that is hot water. Hot water or Ushna Jala, which is given to drink very frequently to the person who is suffering from Jwara in the Ama condition, would enable that person to have the conversion of Ama to Nirama condition, and moreover, because it is a liquid, It will maintain the Jaliya Dhatu due to its Sara and Drava Guna in the person. That means the hydration status of the individual will also be controlled. By virtue of its Ushna Guna and Ushna Sparsha, it does the Sama to Nirama condition. Trishna Nigrahana, it quenches the thirst in the individual, and so on and so forth are the numerable benefits of Ushna Jala in Jvara. One more entity where Ushna Jala is indicated for Vata and Kapha conditions, the Pitta dominated Jvaras, there is a reference for substituting Ushna Jala with Shadanga Paniya. This Shadanga formulation has Musta, Parpataka, Udicha, Chandana, Ushira, Nagara, the 6 herbal drugs that are being processed, and it is a Paniya Kalpana. That means to say 1:64, 64 parts of water with 1 portion of the drug is prepared, and it is given to the person having Jvara to drink throughout as a substitute for Ushna Jala. This is in Pitta dominated conditions of Jvara, while Ushna Jala is indicated for Vata and Kapha dominated conditions of Amaja Jvara. We have also one more food preparation, that is Yavagupana, and this Yavagupana also being a food entity that is prepared with the monocot rice and the dicot mudga. That preparation serves also as a Pachana Upaya, and it is an Ahara Dravya. So, it nourishes, at the same time it helps in the mitigation of the fever by eliminating the Ama dosha in that person. And again this is also indicated for Vata and Kaphaja Ama conditions of Jvara, and it is substituted by Phala Rasa Prayoga in case of Pitta Pradhana, Madatyaya, Madhyanitya, Grishma Rutu and Jvara with Rakta Pitta. These situations, Phala Rasa, that means fruit juices. The phalas which are Jvarahara in their action, like Mridvika, Parushaka, Dadima, these varieties Amalaka are processed, and the fruit juice is given to the person which is having the Jvarahara property in Pitta dominated Jvaras. If we go into the context of Rakta Pitta, there is a reference of the Shadanga Paniya with a slight modification, that is called as Nishunti Shadangodaka Paniya, where Shunti is removed from this combination of 6 herbs, and the remaining 5 which are having the Tikta Rasa are retained. Shunti having Katu Rasa is removed because Rakta Pitta has got a higher involvement of the Pitta in its Samprapti, and Nishunti Shadangodaka Paniya would have a lot of health benefits in a person having Rakta Pitta. Likewise, if we go into the context of Udara Roga, we have the reference of different varieties of Kshiras, and the text tells that for 6 months the person should be kept on milk diet, and there onwards for the remaining 6 months the milk has to be mixed along with the rice. Kshirodana has to be given to the Udara Rogi. Kshira we know by its properties is Anuloma, and it is Ajanma Satmya, right from an infant to a dying person. It is very easily digestible, and it purges the doshas in the downward direction, and in a condition of Udara, this food has a lot of therapeutic as well as dietetic benefits, being easy to digest and having Anuloma Guna. Out of the Kshiras, Ushtra Kshira is the recommended Kshira, though all Kshiras are used in Udara. Ushtra Kshira stands to be in the priority list. Further on, we also have the reference of Takra Prayoga or Kalashaya in diseases like Atisara, Grahani and Arshas, which are related to the GIT in main. And as research has proved, we already know that Takra, that is buttermilk, has a lot of those good bacteria which assist the gut bacteria for better digestion of the food, and these entities like Atisara, Grahani Adi are disorders which are characterized by hypermotility of the gut and frequent bowel movements, wherein the patient, when given with the takra, those conditions will be resolved and it will be supported in the form of pathya to make the person facilitate with the recovery of the disease condition. In the context of Rajakshma, we have the reference of Ajamamsa and Ajakshira. Likewise, if we go into the context of Prameha, there are many preparations wherein yava is used as a key ingredient, and this yava is said to be pathya. Hence, variety of food preparations prepared out of yava are recommended to the Prameha rogi. In Chardi, we have the recommendation of Laja Aksattu as a pathya for the disease condition, so on so forth. These are just a few examples. There are a good number of examples by acharyas that are mentioned in the different disease conditions which are conducive to the individual. We here take one example to go a little bit elaborate on a disease condition, how acharyas have recommended different pathyas wherein food along with some of the procedures are also considered to be advocated in the condition. We take the disease example of Tamakashvasa, and in this context acharyas have told yat kinchit kapha vatagnam, that which will mitigate the kapha dosha as well as the vata dosha are very wholesome and can be used in a person who is having Tamakashvasa. The list is very long, but it is cut short here. In the Kritana Vargas, there is a reference for the usage of the food preparations. Kritana Vargas are food preparations like Yusha, Yavagu, Peya and some Saktu preparations. Madhu we know is an Anupana which is very well used for different respiratory disorders, and it is an Anupana for Kapha dosha. So, any of the disease conditions where we have to prescribe medicines, the best Anupana for Kapha dosha Yukta Vyadhi is Madhu, and in the case of Tamakashvasa being a disease of the respiratory system, Madhu is mentioned as a pathya in the Madhu Vargas. Likewise, in the Shaka Vargas, Tanduliya, Jeevanti, Moolaka, Patola, Vartaku, Rasona, Shigru, these are the pathyas. In the Phala Varga, Jambira, Bimbi, Matulunga, the Katutrayas. Katutrayas have got the Deepana, Pachana and Kafahara properties. Among the Panchakarma, there are certain recommended treatments which are also in the list of Pathya, that the person having Tamakashvasa should be subjected to Vamana and Virechana along with Svedana. Here Svedana refers to Sthanika Sveda on the Ura Pradesha by Nadi, Sankara, Prastara Sveda and Dhumapana for mitigating and elevating the distress that is caused out of Tamakashvasa. If we go into the context of Panchakarma, the treatment area, especially we have this reference of the Samsarjana Krama, which is otherwise also called as the Peyadi Bhakta Krama or the Manda Purvabhiraditaha Bhakta Krama, which is very much indicated and practiced in people who undergo the Panchakarma therapies as Paschat Karma. Now here Manda, Peya, Vilepi, Akrita, Krita Yusha and Akrita, Krita Mamsarasa. These are sequentially given or advised to the patient post Shuddhi, be it Vamana, be it Virechana. the person is put on this diet. It's a step up diet that follows for the next few days of the Panchakarma procedure as an after treatment, Paschat Karma, until the patient comes back to the normal diet. There is a very scientific reason behind this Pathya Krama or the Bhakta Krama that is followed as the Samsarjana Krama. Once a person undergoes any Pradhana Karma like Vamana or Virechana, the entire gastrointestinal system or the alimentary tract becomes empty, and in that stage there is a lot of gut changes that happens, and a person has to have a refractive period before he comes back to the normal diet pattern. And as in our Ayurveda understanding, there is this concept of Agni, where the Agni has to be kindled gradually until the person can come back and start taking the normal food. Here in this case, we have this very typical food pattern wherein Manda is a Bhakta preparation which has a lot of water, that is the liquid portion of the kanji or the gruel is used to the person, where because of the shodhana, either Vamana or Virechana, a lot of body fluid would have lost, and that person is continuously advised to take Ushna Jala during the main treatment day, and then when he starts the intake of the food, it is the insertion of carbohydrates along with the water content in the form of Manda, that is the liquid portion of the rice gruel without any solid entity. Gradually we insert the rice that is called as the Vilepi Virala Dravaha, and the quantity of the rice or the solid portion goes on increasing. So, we have a switch over from the liquid to the solid food substance by gradually increasing the portion of the rice in this ganji or the gruel preparation. So, it is a combination of water along with carbohydrates. Then we have these Yavagu preparations where we switch on from the water with carbohydrate to the protein, which is slightly complex for digestion, and the person is usually given the moong dal along with the rice which is prepared, wherein we commonly call it as khichdi. It is a combination of carbohydrate, proteins along with liquid that is water, and the switchover happens to the protein. This Yavagu can be given in the form of either giving a seasoning with gruta, that is ghee, or without seasoning. Initially it is served without seasoning, and then a seasoning is given where a gradual introduction of fat is done to the person in the form of cow's ghee addition. And now it is a combination of carbohydrate, protein and fat. And then for the non-vegetarians, we have this mamsarasa, that is meat soups, which are either seasoned with ghee or which are unseasoned. Initially again here also we start with the unseasoned soups, and then we switch on to the seasoned soups where a little bit of ghee is used for the seasoning of the soup, and that ends the Bhakta Krama. And if we go into the qualities of meat soups, they are more enriched with proteins and have got good amount of fat also. So, it is now a combination of protein with fats which goes more complex for the digestion, and thereby the person's gastrointestinal system or the gut is prepared in such a way to accept the regular diet that follows next. And then we also have certain Purva Karma diet patterns, like in the person who is undergoing Virechana, we have Pitta Avirodhi Ahara Krama, where any substance that will suppress the Pitta is prohibited to be used, and that which will maintain that Pitta as a Purva Karma, Pitta Avirodhi Ahara is advised during the Vishrama Kala for a person who is waiting for undergoing the Virechana Krama. And for a person who is undergoing Vamana Karma, as a Purva Karma, we have the Kafakara Ahara. These are structured diets to meet the perfection of the Pradhana Karma, be it Vamana and Virechana, where the doshas could be expelled with ease that has been brought from the Shaka to the Koshta, and thereby the treatment has its success and gets the benefit to the person in the form of the reduction or the subsidence of the disease. So, to sum up, we have this Pathya Ahara, and Pathya is one such entity that is explained in Ayurveda, which is very conducive to the Srotas, and not only that, it is also very pleasing to the mind. So, Pathya is a substance which is both conducive to the body as well as the mind. Pathya includes both Ahara as well as Vihara Kramas, and we have talked about Pathya Ahara in this presentation. Pathya Ahara are those foods which are very easy to be digested, get assimilated into the system very conveniently, nourish the body and are also pleasing the mind. Pathya in a swastha is meant to maintain the healthy state of that individual. Pathya in an atura or a diseased person is for the recovery or a control of the disease that the person is suffering from, and this complements the treatment or chikitsa to a greater extent to achieve the purpose of the chikitsa to the atura by the Vaidya. These are the list of references that I had taken for this presentation, and thank you.